Hello everyone, welcome to Student Presentation Week 2025. Myself, Divyani Revalnath AVADHUT, student of B Pharmacy 5th Sem of PR Patil Institute of Pharmacy, Talegaon District, Wardha. Today we are going to discuss on the topic of DIGITALIS. So, the contents of this presentation are synonyms, biological sources, geographical sources, cultivation and collection, microscopic characters, chemical constituents, extraction and isolation, uses and marketed product. Some synonyms of digitalis are given: foxglove, witch glove, fairies glove, dead man bells, ladies glove. Biological sources. The biological source of digitalis is the dried leaves of the biennial herb Digitalis purpurea, which belongs to the Scrophulariaceae plant family. These leaves contain cardiac glycosides and are collected when the plant is flowering, then dried quickly and stored to prevent deorientation. Plant name Digitalis purpurea. Common name purple foxglove. Part use dried leaves. Family Plantaginaceae. Key compounds cardiac glycosides like digitoxin and gitoxin. Geographical sources. The geographical source of digitalis is mainly Europe. Digitalis purpurea, native to Western and Central Europe. Digitalis lanata, found mainly in Eastern Europe, especially Bulgaria, Yugoslavia, Hungary, and Poland. Cultivation and collection. Cultivation of digitalis. First, climate and soil. Grows well in temperate climate, require well-drained sandy loam soil, rich in humus. Prefers cool, moist, shady condition. Second, propagation. Mainly by seeds. Seeds are sown in nursery beds and later transplanted. Third, spacing. Plants are transplanted at 45 to 60 cm apart. Fourth, manures and fertilizer. Requires organic manure and nitrogenous fertilizer for good leaf yield. 5. Irrigation. Need frequent irrigation, but waterlogging must be avoided. Collection of digitalis. First, plant part use leaves. Second, time of collection. Leaves are collected after the first year of growth, from second year onwards. Best collect just before or during flowering, when glycoside content is maximum. Third, method of collection. Leaves are plucked carefully without damaging the plant. Lower leaves are collected first, followed by upper leaves. Fourth is drying. Leaves are dried in shade at a low temperature to prevent loss of active constituent. 5. Storage. Dried leaves are stored in airtight containers away from light and moisture to retain glycosides. Macroscopy of digitalis. The leaf type of digitalis is simple and entire, and the shape is ovate and lanceolate. The size of digitalis is 10 to 35 cm long and 5 to 10 cm broad. Margin is crenate or serrate. Apex is acute and the base is decurrent. Surface D. purpurea. Upper surface dark green, lower surface greenish white, softly hairy. D. lanata. Upper surface dark green, wrinkle, lower surface densely covered with white woolly hairs. The texture is brittle when it's dried. The odor of digitalis is odorless and the taste of digitalis is bitter. Microscopy of digitalis. First is epidermis. Upper epidermis covered with cuticle fewer stomata and lower epidermis more stomata is present. Second is trichomes. Covering trichomes. Uniseriate multicellular band with collapsed upper cells. Glandular trichomes. Two types. First is small glandular with 4 to 2 cell head. Second is large glandular with multicellular stalk and multicellular head. Third is mesophyll, dorsiventral type, palisade cells, 1 to 2 layers below upper epidermis, spongy mesophyll, loosely arranged with intracellular spaces. Fourth is vascular system, collateral surrounded by parenchymatous tissue, xylem towards upper side, phloem towards lower side, surrounded by sclerenchyma. Special features: crystal of calcium oxalate sometimes present, more stomata on lower surface, hypostomatic. Chemical constituent of digitalis. The chemical constituent of digitalis are primarily cardiac glycosides, including cardionolites like digitoxin, G-toxin, and digoxin, which are steroids that increase the force of cardiac muscle contraction. Other constituents found in digitalis lucis include saponins such as digitonin, tigonin, and gitonin, and flavons like luteolin. Extraction and isolation. Extraction of digitalis. First, collection and drying. The uses of digitalis purpurea or digitalis lanata are collected, dried carefully in a shade at a low temperature to prevent decomposition of glycoside by enzyme. Second, powdering. Dried uses are powdered finely to increase the surface area of extraction. Third, defatting. Sometimes powder drug is defatted with petroleum ether to remove chlorophyll, waxes, and fats. Fourth, extraction. Solvent. Alcohol, ethanol, methanol, or hydroalcoholic mixture is used. Method: cold maceration or percolation is generally preferred. This gives an alcoholic extract containing cardiac glycoside. Fifth, purification. The extract is concentrated under reduced pressure. Impurities like resins, tannins, chlorophyll are removed by precipitation or solvent partitioning. Sixth, standardization. Extract is standardized for glycoside content using biological assay, chemical assay, modern method like HPLC spectrophotometry. Isolation of digitalis. First, preparation of drug. Uses of digitalis lanata or digitalis purpurea are collected, dried, and powdered. Second, extraction. Powdered lucid are extracted with alcohol at a room temperature. This crude extract contains cardiac glycoside plus impurities. Third, removal of impurities. Lead acetate treatment removes tannins, phenolics, and resins. Filtration. Precipitates and impurities separated. Solvent partitioning separates glycoside into organic layer. Isolation of glycoside. Concentrated extract is subjected to chromatographic techniques, column chromatography, thin layer chromatography to monitor fraction. Fifth, purification. Fractions containing glycosides are crystallized or purified further. Solvents like methanol, acetone, or ether are used for crystallization. Six, identification and standardization. Confirm presence of glycoside by Kate test, Bulgit test, legal test. Here are some uses of digitalis. First, arterial flutter. Second, cardiotonic agent. Third, arterial fibrillation. Fourth, paroxysmal supraventricular tachycardia. Fifth, congestive heart failure. Here are some marketed products of digitalis. Acknowledgement. I express my heartfelt gratitude to Dr. Nilesh Banarsi sir, our esteemed guide, for his continuous support and motivation and valuable guidance. I am thankful to respected principal sir, director sir, all the faculty members and non-teaching staff for their encouragement and assistance. Special thanks to my friends and classmates for their cooperation and moral support. Thank you. Have a nice day.